Georgina with the Association of British Paediatric Nurses, and today I'm going to be talking to a children's nurse. We're going to talk all about their life and their experiences of being a children's nurse. I hope you enjoy the video. Hi, today we're going to be talking to Holly Avery, who's a children's nurse, and we're going to be talking about all things children's nursing and her opinions on things. So welcome to the interview, Holly.
Hello.
Are you currently a children's nurse or do you work in another field?
Yes, I'm still currently a children's nurse.
And how long have you been a children's nurse for?
I qualified in 2010, so 13 years this year.
Wow. Why did you want to be a children's nurse?
I don't know. It kind of came from, I knew I wanted to work with children when I was in my early teens, and you have to start choosing your GCSEs and your A levels based on kind of what you want to do. I knew I wanted to work with children, and then this is going to sound really terrible because actually now I hate this program as a nurse. But I used to watch Casualty with my mum and my dad when I was younger, and I used to think, oh, I could do that. Like that looks like a really amazing job. I really think I could do that. And then I did some work experience when I was 17. I did a week in an adult ward and a week on a children's ward, which I was so lucky to do because now that's really hard to get experiences like that. And I love both, but children's nursing, the week on the children's ward was amazing, and that's where I knew then where I needed to go really. And luckily, I had chosen my GCSEs and my A levels based on working with children and in the medical kind of field. So yeah, luckily I was kind of chosen what I wanted to do. I was on the right path anyway, and then that work experience really kind of made my decision for me. I knew I definitely wanted to be a children's nurse.
Oh, that's brilliant.
Yeah, I remember a baby threw up all over the floor, and the nurses were like, "Oh, here you go, like you can clear it up." And I was like, "Okay," and it was like didn't faze me at all. A 17-year-old, never really been in that sort of environment before, and I was like, "All right," and I just kind of got on with it. And I thought, "Yeah, I can. If I could do this, I can definitely do this."
Yeah, definitely. So, what did children's nursing training look like for you?
Obviously, three-year degree program, same as most people. I had like a real variety of experiences. I was really lucky where I trained. We had a real variety, community placements and acute placements all over the area where I live. So that was really insightful. I always think of it as like try before you buy when you're a student, because you can try all these different placement areas, and then it really helps you decide what sort of nurse you want to be when you qualify and what sort of area you'd like to go into.
Yeah.
Without obviously having to apply for a job and then work there and then think, oh, actually, this isn't really my type of nursing. I want to do something different. So that I find that it was really helpful to be able to see what sort of nursing I wanted to do.
Yeah.
So yeah, I was really lucky.
What's your favorite part of being a children's nurse?
Obviously, I think most people say it's the children. They are just so different to adults. They're really honest, and they don't like us as adults. And you don't feel well. We are, oh, I don't feel well, and we can be quite dramatic about it. Whereas children just, oh, I feel better now. Can I go and play? Or they start, they start to play, or they start chatting away to you, or running around, and then you're like, oh, okay, they're better, they're feeling better now. And that's what I love about working with children. They could be really sick one day, and then your next shift or 2 shifts later you come back and they're like completely different, really chatty, playing, and you're sending them home. And that's what I love. They're really honest, they're really funny. They're very black and white. There's kind of no grey area with children. They either like you or you don't, and they'll tell you if they don't like you. And so I love the honesty, and I love just their spirit and their character. I think children are so much more resilient than we could ever give them credit for, and so much more so than actually some adults. And that's what I love about working with children, is that they just are so resilient. They put up with things that you just think, I don't even know how I would cope with that, and they just get on with it. And they, as soon as they feel better, they want to play, or they want to watch something, or they want to talk to you. And yeah, it's just I couldn't work with adults, I don't think, because of that. I love the fact that they are just so, they just get on with things and they're just really honest.
Yeah. Do you have a moment that sticks out in your head of like your best experience in children's nursing?
There's been a few, I think mainly around where things have been bad, you know, like where children have been really, really sick, or they've had bad news, or they've had like a not very nice diagnosis, and you, although it can be sad, you can see how you're helping the family and the children, and a mum or a dad could turn to you and, at the end of your shift, and say, thank you so much, like you really, you know, made the difference today. I had one recently, a teenager with an oncology patient who was just having a really bad day. She just was, you know, really tearful, really emotional, and I really advocated for her. Like, professionals were wanting to go in the room, and I was saying, you know, please don't go in there. She's really upset. She's not in the mood to be, you know, talking to different professionals today. And she was old enough to, you know, she has capacity, so she was old enough to kind of make those decisions. And at the end of the day, she was like, thank you so much. You know, you've really helped me today. You've really stuck up for me, and you've let me moan and ran. And, you know, I sat with her when her parents went out for a bit, and we just talked. And it's things like that, like really simple things. It doesn't have to be anything big. It's not, you know, doing resuscitation or, you know, anything dramatic like you see on TV. It's those little things like advocating for your patient, or sitting with your patient and just letting them talk to you, and kind of like go with all their feelings, you know, and let it all out, and just being there for patients, and just to have that at the end of your shift, like, thank you so much. That is, you know, that means everything. That's what makes you go back the next day and do the job, you know.
Yeah. And what does a typical day look like for you as a children's nurse?
So I mainly work on a children's ward. Sometimes I do shifts on an assessment unit, but I am definitely an acute nurse through and through. Love acute nursing. So I work, yeah, mainly in acute paediatrics on a general paediatric ward. I have specialised in the past, but where I do my shifts currently, and where I've done the majority of my shifts, it's a general paediatric ward. So I tend to do day shifts. Night shifts are interesting for me. I think now I've got children and I'm a bit older, I find nights really hard, but I can do long days, that's fine. So we have our handover, we go out and see all our patients, check on our patients, and then we have the consultant ward round. We have consultant ward round every day. I know that some adult services don't always have that, but we do in paediatrics, where I work anyway. We have a consultant ward round every day. And then we obviously have the plan for the day, what we're going to do. Oh, you know, are our patients going home? Are we going to start some different medication or some different treatment? You know, we're obviously throughout the day, we're doing observations, giving medications, you know, talking to parents and families and children, and, you know, discussing what the plan is going to be, and, you know, assessing how they are. They're getting better? Are they getting worse? Are we worried about anything? Hopefully we have a lunch break at somewhere along the way in there, and generally where I work we are pretty good at making sure that we all take our lunches, and then, yeah, in the evening we obviously meds, documentation, and then hand it over to the next shift.
Yeah, brilliant. Do you have a personal mantra or philosophy at all?
Not, I don't know if it's a philosophy, but the question I get asked the most, or the thing that I get said to the most about being a paediatric nurse is, oh, I don't know how you can do that. It must be really sad. I get that all the time. People, you know, quite often just think it's really sad. You know, you must all be really sad and crying all the time because it's so, the children are really sick, and, you know, that can be quite hard to deal with emotionally. But what I always say is that, yes, it can be sad, and there can be days where it's more difficult than others, but I always think, my role here is to try to make things better. So even if I can't make the child better, so if they've got like a life limiting or life threatening condition, or they're, you know, receiving end of life care, for example, I can't make that go away, but whatever I do in that moment or within my shift, everything I'm doing is trying, with the goal of trying to make things better. So even if that's comforting a parent and making them a cup of tea, or, giving pain relief, or anything, whatever we do. It might be sad, like you might have to hold a child so they can have bloods or cannula put in, but it's ultimately, the ultimate aim is because we need to make them better. So once they've got a cannula, we can give them medication and fluids, and then they will hopefully start to feel better, and then it's all for like a positive end goal. And so I think that's how I frame it in my head, because I think otherwise you could be really sad all the time and think, oh, this job is really hard. And I can see from outside looking in how people think that, and people may think, I don't know how you do that, I could never do that, I would just cry all day. And I can see where that comes from. But for me, and I think the way I deal with it is, but I'm trying to make things better, I'm trying to help, even if it is just making a parent a cup of tea, or finding someone an ice lolly because that's what they want to eat, or changing someone's sheets so that they're comfortable. Even the smallest things, I think all of those things are just trying to make life a bit more comfortable or a bit better for that child and the family. So I don't know if that's a mantra, but that's kind of how I see it, and that's the most common thing I get asked or told all the time.
No, that is a lovely way of thinking about it, especially with when you're having to do really hard stuff like holding down a child to do the bloods or something. It's a lovely way to think about it, but this is going to help.
I mean, we try not to. We try to get parents to help with holding where we can, because it's much nicer if a parent can like cuddle a child to kind of hold them. But even when a child is screaming because they're not very impressed with you and they're not very happy, understandably, I always think it's okay. In 10 minutes this will be done, and then we can get you some medicine. We can get you all comfy in your bed, and we can put the telly on, and we can find you some toys. And I'm always thinking about what we're going to do next to kind of make this feel, make you feel better and make this situation a bit easier.
Yeah. What qualities do you think somebody needs to have to be a children's nurse?
I think you need to be really resilient, definitely. But I think you need that to be any sort of health or social care professional. You definitely need really, you need to be really resilient and able to kind of roll with the punches, so to speak. Like kind of, you don't, especially if you work in an acute setting, you don't know what's coming through the door. So it is very much, oh, okay, this is happening now, and I'm just going to go and do that, and you really do have to kind of just roll with what's going on. You definitely need a sense of humour. You need to be able to laugh at yourself. You need to be able to laugh with the children and the families, and be able to have a laugh and make things, try to have fun with the children where it's appropriate, and so definitely a sense of humour. Obviously all the other things you would expect from a nurse, so like kindness, compassion, empathy. You have to be really good with your time management. You have to have really good time management skills. You have to be really organised. You have to be a good communicator. The majority of our job is around communication and talking to professionals and families and children, and adapting that communication depending on who you're talking to, especially in paediatrics, because you could be talking to a 2-year-old 1 minute, and then the next you're talking to a teenager, and then you're talking to an 8-year-old. And so how you communicate, obviously you have to adapt that depending on their age and their developmental stage. So, and then you have to deal with maybe angry parents or other professionals who are waiting for things, or want to liaise with you. So you're kind of constantly switching from different situations to different, communication skills. So definitely communication skills.
And if you could give advice to somebody wanting to be a children's nurse, what would you say to them?
I would say, make sure it's definitely what you want to do. Nursing is a job you have to do because you love it. It's not a job that you think where you pick a degree and think, oh, I'm just going to go to uni and do this degree because it'll be really fun to be a student. It's not. Nursing degrees, and actually all health and social care degrees, are hard. They're not standard degrees where you can fall asleep at the back of a lecture theatre and there's 200 of you there and no one kind of really notices or cares whether you fall asleep. It's very different. You have to attend your lessons, you have to attend placement, you have to want to do it. It's you have to have the passion and the love for the job, because it's hard, and the training is really hard, and then the job is hard. It is a job that you have to do because you really, really want to do it. And so the first thing is definitely make sure this is definitely what you want to do. do lots of research around the role and look up the important things like NMC guidelines and Royal College of Nursing and NICE guidelines and all things like that. Kind of have a really good look at all the different things that kind of help you prepare. If you are going to university to do it, then that's where you can kind of start to get your head around those sorts of things. You need to be super organised with your studies and then with your placement, and then when you're qualified, you have to manage your time really well. You have to be really organised. You have to know, because those are transferable skills. To be organised with your university work and know when your deadlines are, that transfers directly into patient care. So when are my medications due? When are my obs due? When do I need to do this? When do I need to do this? When, I've got 4 patients, so actually I need to do this first, and then I need to do this. And it's all of that, like being able to manage your time, working out what is a priority, and then right, I'm going to do this first, then I'm going to go to this patient and do this, and that it's very transferable skills. So you have to be super organised, to be a nurse.
Yeah. And what are the biggest challenges that children's nurses are facing at the moment?
I think it's just all things that we all know about, that are in the papers, that is on social media, that that's going on right now. I mean, right now the doctors are striking, aren't they? Today, as we speak, the doctors are striking because of paying conditions, and obviously the nurses have been striking this year. Nurses in general have been striking as well, as have other professions. So it's the stuff we know about. The NHS is loved. I think on the whole, the public love the NHS and appreciate the work that they do, and appreciate the people that work for the NHS. But it's just funding and staffing and support, especially post-COVID, where it's been really difficult. Potentially not so much in paediatrics. So I think we were potentially a little bit more protected in paediatrics during that time, but I know a lot of my colleagues were kind of redeployed to other areas, including adult areas, to obviously help out. So that's been really traumatic for a lot of nurses, and so it's about having support there for them as well, and just being paid for the job that we do, and the pay that we deserve, because the degree is hard, you work really hard, we're extremely qualified professionals, and it's really difficult because there's a lot of different opinions, isn't there? But I just don't think, it's really hard to quantify what a nurse is worth, because actually I think, obviously I'm biased, but I think we do a really, really good job and we should be paid really well for that.
Yeah.
But I am biased, I'm always going to say that. And I think we do an amazing job, and so that should be reflected in our pay and our conditions. It shouldn't be, did I get a break today? It should be, yes, every day I get a break, because that's what I deserve to have. So
yeah. And when things are hard with work, what keeps you going?
I think it's like I said before, like those little moments of it might be a really little thing. It might be like a child giving you a high five, or a parent saying thank you so much for today. That's what keeps me going. You have to have those little glimmers of hope, or little glimmers of, this is why I do this job, or when you've had a really, really sick child and then you send them home and you think, that's amazing, they were so poorly and now they're going home and they're feeling much better. That you think, that's why I do my job, that's why I come to work every day, because I want to, that's why you come into it, that you want to help people, don't we? We want to help people, we want to see our patients be well enough to go home. We might not cure our patients, but we to at least get them to a point where they can function and have a good quality of life and be able to go home with their family. That's, it, to me, it's like a variation of all those things, including little things, like even just someone saying thank you so much, or a mum, giving us a card when they leave, or a child drawing you a picture when, because they're so happy with the care they've had. It's all the things like that are so, that's what makes you want to do your job.
Yeah. And I know you wouldn't necessarily have contact with the child before they came into hospital, but if you did and they were worried about coming into hospital or scared, what would you say to them?
I would say it's completely understandable to feel scared, especially if you've never been in hospital before. It's a completely new place, a new environment. You don't know the people. Hospitals smell funny, and there are weird noises, and there's lots of people. So I completely understand it's scary. But the nurses and the doctors and all of the professionals are there to help you. And so if there's anything you're worried about, you need to tell us and talk to us about it. On children's wards and in most paediatric areas now, we have play specialists who obviously can help. They'll bring toys and they can help distract you and find you things to do to keep your mind off being in hospital. And if you're feeling well enough. Sometimes we have the pat dogs, the dog, like the therapy dogs that come in, and we have all our other types of visitors and things. At Christmas time and Easter, we have loads of visitors and they bring loads of stuff. So actually, you could leave hospital with Easter eggs and presents and toys, and so actually it might not be a very nice experience, and the reason you're in hospital is not obviously ideal, but we try to make it as nice as we can. There'll be toys and there'll be things for you to do, and you might even get to go home with some nice things as well.
Yeah, that's lovely. What do you think is the most important thing that nursing has taught you?
Oh, definitely patience. I can be quite an impatient person kind of at home, outside of my professional kind of world. But at work, when you've got your nurse hat on, it's definitely taught me patience and resilience and, just a whole load of respect for children and families that are going through what they're going through, and amazement at how people deal with stuff. And it definitely makes you appreciate things more, because especially when you've got your own children, because you can't help but compare, oh, my child is 3 and that child is 3, and like, look what that family is going through. And it makes you appreciate things so much more. It makes you realize that having your health is everything. You can't put a price on that. Doesn't matter if you're a billionaire, if you don't have your health, it can be, that can be really life-changing. So it definitely makes you go home and squeeze your children. When you get home from your shift, you definitely feel more appreciative of the fact that you are healthy and that you have your family there. So I think it's the simple things, isn't it, that makes you realize you don't need loads of stuff and loads of money and things. It's about family and love and the people that are around you, and that's what's really important. So yeah.
And what do you think is important for us to focus on in looking to the future of children's nursing?
I think we need to keep banging our drum, because we're a very small community in relation to maybe adult nursing and mental health nursing and maybe some other professions. So I think it's really important that we do things like this and are promoting our profession, and stamping our feet and shouting and saying, no, paediatric nurses are here, and we are important in the NHS cogs of the machine. So that is definitely important. I think obviously going into the future, things like staffing and how the NHS is going to look in the future, that obviously needs to be looked at and considered and thought about. Pay and conditions will be better.
Yes.
And I just hope the NHS is going to be there for a long, long time to come, and that it's not going to be completely disappear and sold off into parts. I hope it's still there and serving the population for, well, at least the rest of my lifetime anyway.
Yeah, no, I agree. And the big question is, would you encourage other people to take up children's nursing?
Yes, definitely. I think nursing in general is an amazing career to go into. But obviously I'm biased, and I think paediatric nursing is, an amazing career choice. Our patients may be small or, have much different, really different needs to adults and other members of society. But it's really important that we have dedicated paediatric nurses who are trained in paediatrics to look after these children. Children aren't just small adults; they are their own, functioning people, and their anatomy and physiology is very different, and the way you treat them is very different, and the conditions that they have are very different. So yeah, definitely would encourage people to go into nursing. As long as it's what you want to do, you will always love your job. You will never wake up in the morning and think, I hate my job. Hopefully, you hopefully would always, I never have moments where I never think I don't want to be a nurse anymore. You might have a bad day, but I never think that's it, I'm going to quit and, give up my PIN number and never go back. I've never felt like that in 13 years.
That's
So,
brilliant.
yeah, sometimes you need a holiday, but you never feel. I've never felt like I want to leave it completely. I love nursing.
Good. I'm so glad. It has been such a pleasure talking to you. Thank you so much for agreeing to have this interview.
That's okay. It's really, yeah, it's nice to, easy to talk about your career when you enjoy it.
Yeah, definitely. Thank you so much.
Thank you.
Bye. Thank you so much for watching our video. I've been Georgina with the Association of British Paediatric Nurses. If you enjoyed our video, please give us a like and subscribe to our YouTube channel. And if you have a question you'd like to ask a paediatric nurse, pop it in the comments below and we'll see if we can ask it in one of our videos. Bye!